there, hopefully about 10 minutes before 3. So we'll have a time to take a picture. So I like to put myself with you. And the exam will be a written test, sitting apart. I think you should have a mask at hand. So that will do that. And then final grades, I'm the person to give you final grade. I was assigned by your school. Homework research put together will be 40%. Your final exam will be only 40%. And my judgment of how good you are in sincerity and your attitude in studying, 20%. So, as you communicate with me and ask me questions, that'll count. When I read your homework, if your homework is sincere and a good attitude, when you write your report out of your heart, out of your own knowledge, or out of your brain, instead of pasting and copying somebody else's. As long as you copy and pasting, you write the sources. I did this one from this author. That's very good honesty in science, especially in medical science. If you do not quote that, if you do not write where I learned this one, this particular paragraph, you copy it. If you do not write on it, that means you stole it. So that's not good. So anyhow, learn to be honest. So sincerity, your honest attitude will count 20%. So that's subjective, that I will try to be fair and just, and hopefully you will get all good grade, all pass. I don't want to drop any one of you. That will be my sadness. So that's not good. I'm here to give you a good grade. Everybody show your sincerity. I did my best, teacher. Yeah, you show me. All right. Now we'll go to dermatology. I have no time. Wow, goodness. So may I have this switch over? I should not forget this one. Okay, now I have to be honest. I have final exam problem paper in front of me. This is going to be given to you, and you will write your answer. And these questions are collected from other professors. I think before me, there were 6 lectures. Yeah, the other professors gave me the problems. And then I added 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 questions. So these are the questions you're gonna get, and I am not going to tell you what exactly the problem is, but I will give you a hint. Means use my hint as a way to study your final exam. Therefore, you will study again. Yeah. So that means you will be another way to be smarter. In other words, this exam preparation will give you another chance. And I'm going to use this chance to make you study, to allow you to study. So anyhow, so there are some questions given by other professors, but that is the textbook. So when you study textbook, and when you think about it, the professors emphasize, this may be the chances. Oh, maybe the problems you will get. But since you have only textbook, study honest and sincerity and your good attitude, and you will be all right. So I have told you that what was important. I think in medical school, learning the names of 12 cranial nerves in Korean and English and their function, what they do. What does optic nerve do? What does auditory nerve do? So you're gonna write what does function is. And I began as a cardiovascular system terminology lecture for the first. So there is the pathways of greater circulation and lesser circulations. And also I emphasized unconscious. The unconscious is very important to write about it. So I like to include what I told you that unconscious is, in contrast to the conscious. And contrasted to, well, it's about the doctors who proposed, at least 2 doctors proposed unconscious. So you're gonna write about it. And how we see, how I see you in front of your desk. I have to imagine your face. So how you see from the object to your final visual cortex, which is your occipital lobe. So starting from the object to the occipital lobe, you're gonna write all pathways you're gonna go through. Yeah, that is sort of important. And also today I'm gonna give you a lecture of dermatology, and dermatology is mainly descriptive science. So how you describe the rash, what you see, how it looks, what's the color, what's the shape, how you feel when you touch it, is it watery, or those kind. So all descriptive terms of dermatology you're gonna write. And I give you good terminologies in endocrinology. So I may ask you, hey, write all the medical terminology what you learn in endocrinology. Yeah. So that is what it's gonna be. So, and what else? And the what you see in normal chest X-rays, and name of the all infectious diseases, name all those benign and malignant neoplasms. So at least my questions, you are going to write all what you know. There will be empty blank space. You write with your pencil in both terminology, in Korean and English. Write spelling as many as you can. Therefore, when I read your all answers, it helps me to evaluate your knowledge and your sincerity and your attitude. Okay, so that is for sure. So now dermatology, and I have only 15 minutes. So let me go over dermatology and finish this first section. My second section, hopefully short, I told you so many, but I need to go over some good terminology in dermatology with you, so that be sure you know what I mean in your study. Okay, now dermatology. Dermatology is considered to be minor department in your hospital clinical faculties. Minor means usually 1 or 2 professors and some few other faculties, compared to the internal medicine, there are so many, usually 50, 60 professors in there in my school, when I remember. So dermatology is minor department, but I'll tell you, dermatology and radiology are quite a bit good specialties if you like make money in the States, in the United States, because they are popular. Why? I think it's dermatology is beauty science. People want to be pretty, beautiful. Therefore, what do I do when I have a concern? I go to dermatology, plastic surgeons. So that's the reason, I think. The radiology is very technically oriented, and you need lots of skill to do it. Somehow, some reason, many people in America feel that good department and good life to practice radiology. So anyhow, it's gone. So function of skin is very important. I sat down, what does skin do? And skin is actually largest organ of your body. If you consider skin is the organ, skin is actually often not considered to be organ. Liver and spleen, brain, yeah, these are the important organs. But skin is organ, answer is yes, that's largest. Your body weight, usually 15 to 20% are skin. You are covered by skin. So protection, important. Without skin, you cannot live. Without skin, you don't look nice. And without skin, you will be chilly or you will be in trouble. All the germs will get into it. So by protection means you are insulated from physical, biological, and thermal. Too hot, too cold. Your skin is needed. Identity, color, shape, individual, when you smile, and flushings, and cosmetics, aesthetics, all those beauty plastic surgeon will do something with your skin. So that's important part. Sometimes too much emphasis on cosmetics and aesthetics. So inside is not good or ugly, but outside is pretty. That's not good combination. I like to see outside is beautiful, inside also good. If you cannot do that, just then inside is good, outside don't care. Yeah. Outside ugly, but inside is good. That is beautiful things in the world. So remember the Notre Dame 꼽주? Hunchback of the Notre Dame. And that's ugly looking person, but has beautiful mind in it. The novel by what? Victor Hugo, right? All right. Number 3, immune system. They are immune active, immunological active part in allergy, sensitivity, defense mechanisms, and so forth. And has a tactile sense, yeah, your hairs know all those pressure and thermal nerve endings going over there, so that I know my fingers are touching each other. And sweat and gland, and sebaceous gland, so it is sort of exocrine gland. So the sweat, there are 2 kinds, eccrine gland, apocrine gland, sebaceous gland. So sweat is very important. I'm sweating because it's hot. Okay. And then lastly, when you look at the skin, often I don't mean all of it, you make diagnosis. Yeah. Pediatrician IM is best specialties. Look at the child with a rash, make diagnosis. Of course, you ask a few questions, but I don't mean you just see it and make diagnosis. Yeah, you can do that. Chickenpox is very typical rash. When you look at it, you know that is. Measles, I saw a few measles, but measles is very hard, very rare to see because it's just all got vaccinated. So these are the 6 functions of the skin. Just, yeah. And remember the layers of skin, yeah, it's important so that, and then we have terminology, page 466, 467. So terminology is very important. As I said, dermatology is descriptive science. When you look at the rash, of course you can take a picture, but it is not as good as describe it. When you describe that, you will have unique opportunity to say the particular nature of the rash. So I put it this one, there are so many descriptive terms in dermatology. The more you remember, you write on the paper, you will get better grade. Yeah. Erythema, erythematous. Papule, papular. Nodule, nodular. Scale, scaly. Pleuritis, pleuritic. Itchy, itchy. And petechia, ecchymosis, ecchymotic. Purpura, purpuric. Lichenification, leukoderma, melanoma. So it has its own meaning in it, so I hope that I don't have to explain to you, but you can read your textbook, it says something in it. Now, excoriation, crusty, crust, cicatric, oh, maybe A is missing. Fissure, alopecia, eczema, eczematous, erysipelas, folliculitis, carbuncle, impetigo, urticaria. Ichthyosis is, I think in Koreans, it's another unique name. It's a skin condition. When you look at the patient's skin, doctor, my child is born with this kind of skin. It's like fishy skin, fishy scale. So ichthyosis, it's a genetic diseases, runs in family. Shingles, scabies, wart, verruca, and more. So when you then write that terms, you write in English and Korean, and if you can write between, well, more than 50, that's good. 50 means in English, Korean plus, that means 100, right? So 50 terms in both Korean and English in your exam will do the job. Okay. And it's an important part in your clinical practice, body surface area. When you see the patient with burn, 화상. So when you see them, what happens? They have, burn skin. So you have to know 2 things. How much the skin got damaged, thermal injuries. So you kind of figure it out in percent. So when you look at the book of burn, rule of 9 gives you ideas in 9%. Head 9%, each arm 9%, your front part 9%, back part 9%, and your extremities, each of them is actually 18% each, and your neck, I think 1%. So that way you will get rough estimation of the area, how much the patient has burned. That really determines what to do about this patient. If the patient has 5% burn, oh, not that bad. But if that goes 10% or 20%, you're gonna put the patient in the hospital. Because when you lose the skin, your body loses the function of survival. They can get infected, dehydrated, pain, all those. Yeah. So there are burn center in the hospital. They receive only the patient with burn, chemical burns and thermal burns, and they have a treatment centers. So it's a kind of important part. So in burn, the skin areas. And nomograms and equations, it gives you ideas how much fluid they need depending upon these equations and graph, so that you will learn this one, you will find in your textbook, and so forth. And normal person have 1.73 square meter. So your healthy person, yeah, you have 1.7 square meter of the body surface. So it determines that how much fluid you need. So I remember that 15,000 milliliter per square meter of the body surface area per day of fluid you need. So these are something to do with your skin informations. And here, so simple, the one simple things in dermatology is the kind of medicine dermatologist uses. So few. There are many. Only within your finger, you can count with your 10 fingers. So there are not many kind of medication in dermatology. In contrast, the kind of name of diseases in dermatology are so many, and many of the diseases actually have no special treatment. You observe, you put this ointment, a couple of them. That's pretty much it. So the name of the disease in dermatology